Compared to the global trends, the Indian patients are being diagnosed with heart failure almost a decade or two earlier than the Western counterparts. And the in-hospital mortality is almost 10 times than what we see in West. Even the post-discharge mortality is in the tune of, at the end of 6 months, to the tune of 3 to 4 times than we see in West. So the Indian patients, 23% of these patients with heart failure die within a year of diagnosis. And if you look at the cardiac mortality causes in India as well as in Africa, which are the poorer or the developing countries compared to the others, the cardiac causes of death are almost 2 to 3 times higher than their counterparts in the other parts. And the rates of heart failure survival are worse than most of the cancers, be it bowel cancer or breast cancer or prostate cancer, as I showed you in one of the earlier slides. So the prevalence of heart failure in India, the truths are that at least 8 to 10 million patients with heart failure reside in India. Prevalence is about 1% adult population. The post-admission mortality is 20 to 30% in India. The medication compliance is very pathetic and poor, between 25 to 50%. The population suffering from heart failure here is relatively younger, as I said, 1 or 2 decades earlier in heart failure population here. The incidence of diabetes in heart failure, as was evident in Trivandrum heart failure registry, was almost more than 50%. And this perhaps could be the maximum in the world, that the diabetes coexist with heart failure in our country in very high population patients. And the hypertension also accounts for almost 42% patients in heart failure population. The key points are that the every five patient, 3 out of every 5 patients had died during 5 years of follow-up, with a median survival of approximately 3 years in this young cohort of heart failure patients in India. The lack of starting a GDMT in these patients with HFFF and frequent readmissions were associated with high 5-year mortality. Only 25% of patients were discharged from index population on GDMT, which is the guideline-directed medical therapy. And those whose prescriptions had this GDMT at discharge were associated with much lower 5-year mortality than patients who did not have it. And the interventions aimed at increasing guideline-directed medical therapy would actually improve the heart failure outcomes in India. And that's the whole purpose of conducting this lecture with you. The goals of therapy in heart failure range from increasing survival to reducing the hospital admissions and ensuring a good quality of life in these patients. Because with each hospitalization, the survival benefits or survival chances of these patients are going down like a cascade. Eventually, 50% of patients of heart failure or HFrEF dying at the end of 5 years.